swelling is a big concern for almost every patient regarding facial surgery. And we've done a lot in terms of minimizing that with certain procedures that we incorporate certain techniques, certain medications. So that's something we've achieved some good success with to help minimize some of the bruising and swelling. But inevitably, with these types of procedures, bruising and swelling is expected. We found to help really minimize some of the bruising and swelling, it starts off preoperatively. So some medications that are known to cause some more bruising and swelling are aspirin, ibuprofen, some herbal supplements such as fish oils and vitamin E supplements. We definitely recommend stopping those prior to. We have a consultation beforehand to go over every patient's medications and herbal supplements that they may be taking, and we kind of cross-check those to help minimize some of the bruising involved with that. Post-operatively, I think certain things we can do to help minimize the swelling as well. Icing is important. I think icing does work, and it helps first 48 hours after the procedure. So particularly maybe for a rhinoplasty, for an eyelids procedure, bruising around the eyes can occur. So icing can help with that first 48 hours. And then finally, just taking it easy, refraining from doing anything too strenuous, not hitting the gym a week or two. That's pretty ambitious. So really taking it easy. We recommend on average probably about 4 to 6 weeks from doing anything too strenuous afterwards.